Well, it's okay. Let's go on. Doesn't matter. The screen whenever it comes. Okay. Hmm? Is it okay?
Yes, sure.
Okay.
Did it come on now?
Yes, Ganesh.
Yes, sharing information with your doctor.
Right.
Is it? Yeah.
Yeah, I'll fit it to the screen. Okay. My apologies, Dr. Rangarajan.
No,
It's
no,
the
no.
technical
No,
works
no,
today.
I should have warned you that I'm extremely technologically challenged. I didn't do that.
Go on, sir. I will share as you cue me. I will change the slide.
Okay. Because again, thank you, Ganesh, and good evening to everybody. I hope all of you are doing well. Let's see what little I can say. I hope I'm reasonably sensible. If I'm talking nonsense, feel free to say so. No problem with that. Okay. Um, okay. The way I'm looking at this is, look, we yeah. Just get the next slide, please. Yeah. So we are all actually in a game here. Hmm? Ganesh, can you get the next slide?
Yes. Yes. Is that visible now?
Yeah, the game. Yeah. Hmm?
Okay. Now I've got the hang of it. I don't think I should take time. I'm sorry.
Okay. Yeah. So the game here we have is not a game we play on a computer screen or on the or a board game or anything. This game is a game we play in life. Various people, whether they want it or not, are brought into playing this game. I mean, I guess when I say that as a doctor, I've chosen to play this game. I'm part of the game. Okay. There are people, the Shubhartis, who unfortunately go through some experiences. And this game is played, like I said, the pitch is life. Various factors, of course, influence the game, like the dew factor and the nature of the ground, the nature of the pitch, the size, you know. But for all of us, it's still the same game. Can I have the next slide, please? The players. So when we have this game, who are all the important players? The various people around. Like I said, I'm one player, but we'll come to me later. The main player. The next slide, please. The main player is the Shubharti, the person. So it's a new word I've learned today. The person. The person who's going through a very difficult to understand experience. A person who is struggling with various issues in their life, with some very bizarre ideas, thoughts, perceptions, emotions, which seem to kind of impact their own thinking process and also interfere with the way they interact with the world around them. So then that brings in the next people in the game. The next slide, please. Family. So whatever happens to the Shubharti, the family gets definitely involved because they are the ones who are seeing a change in this person, and and that kind of uh, gets them very confused and sometimes frightened even to begin with. The family and friends who are there around the person first start seeing something unusual happening, and this person they are not able to completely understand and cope with it. Maybe the Shubharti also is not able to explain exactly what he's going through, and so this the next bunch of players are there around until they are able to become Shubhankars. I guess lots of things have to happen. They are intrinsically interested in caring. They don't want to hurt, they don't want to harm, but the person who is going through the Shuvarti sometimes is not able to figure out who's going to help, who's going to harm, and who understands him, who doesn't understand, who's being, friendly and supportive, and who's going to be hostile, critical, and damaging. So the family and friends are the next players, next bunch of players in the game. The next slide, please. And then it starts impacting whatever we are doing. You're a student, definitely you're going to have trouble with the school, with the teachers, with the system, with the class, your peer group. What you're studying is going to be difficult for you. Uh, you're not able to give that much of focus to studying. People again, you know, remark like you've dropped in performance, not a good student, and that bothers. Same thing happens in the office where you're not working to your full efficiency. There seems to be again people, both your peer group, your friends find you different, your co-workers find it more and more difficult to work with you, and you find it more and more difficult to interact with the peers and the co-workers. So the game continues. The next slide, please. To the community. The community at large suddenly seems to kind of find somebody unusual amidst them, and some of them are not so very kind and caring. They could be extremely hostile, they could be very punitive sometimes. Of course, the horror stories are less nowadays as compared to before, but it still can happen in some places. Of course, in some community, they might even look at this person as some god man, isn't it? Unfortunate situation. That is even more unfortunate because this is a person who is grappling with his own mind and the thoughts and the feelings he's going through. The last thing he wants is a bunch of people who come in and show arati to him and worship him and start one business around him. So this is going to be even more difficult, the community. Yeah, the next slide, please. And then the last player who comes in, the doctor. Well, the doctor, like I said, amongst the whole group, the doctor seems to be the only willing participant. This person is coming. Some people kind of think that the doctor is the referee and he's not playing the game. The doctor is not the umpire or the referee. He's as much in the game as anybody else in this whole situation. The doctor is trying to kind of make sense of what's happening, try and understand it based upon some theoretical background he is having and his knowledge, and applies the whole thing and tries and interacts with everybody else here. Now, this is a game all of us here are playing, and the opponent here is not each other because all of us are in the same team. The opponent is the illness, the mental health problem itself. And where we tackle the whole problem is going to be, going to tell us now how the game ends, how the game progresses and how the game finishes, and who comes out a better person from the game, or is it going to be, a very sad scenario for everybody in the team. No single person actually kind of, gets anything out of this. Everybody gets positive or everybody gets negative. Am I making sense here? So the game is where all of us are playing. So given this kind of a game, there must be rules to the game, isn't it? The next slide, please. Every game has got rules, and this game also has got rules. And the rules are very, very simple. Can I have the next slide, please? Ganesh, can I have the next slide? Yeah. The most important rule in this game is patience, because we need a lot of patience to try and understand and figure out what's happening. The Shubharthi is definitely very impatient because he is the one who is really struggling and suffering, and he's trying to make sense. But everybody else in the whole game also are struggling to understand and trying to make sense of the whole scenario and get something good out of this. So, the first rule of this game is patience. Nothing works fast, nothing works immediately, and nothing works by being hostile or angry or wanting some kind of a quick answer to all this. So, we need patience. So, we start with patience there. Right. The next slide, please. And trust. Now, trust is a small word, but it's a huge thing. You know, unless we can trust each other to be non-judgmental, to be gentle and honestly being able to understand the whole thing, nobody can win this game. The Shubharthi has got to trust the family and the friends and the people around him and the doctor. And the doctor has to trust everybody else to hear. So when we are able to talk about what really is happening, and the doctor also is able to talk about what he understands from that, we can have a discussion which kind of will improve the understanding of the scenario. Because the doctor may not make sense of it also in the beginning. The doctor is not an all-powerful, know-all everybody, know-all person. He also is actually trying to figure out what is happening to this Shubharthi and how it is impacting on people around him. And he's going to try and see what best he can do to make the whole system work smoother and the game progresses in a nice way. But the doctor is only as good as the information he gets. That's one a very blunt statement I tell most of my patients. If you feed me bullshit, I would give back the same kind, isn't it? It's not that I want to give bullshit to anybody. It's not that you want to give bullshit to me. No, sorry for the profanity, but I don't think anything else explains it better. So if I get information which is not good, see, sometimes I get information piecemeal. Sometimes people kind of, give it as if they're playing cards where they expose their cards one by one. There's no such thing. Only when there is trust and open communication there, the patient gets the best deal, the family is able to understand the patient, and together they would be able to come into the doctor and discuss what's happening and move on from there, where the doctor is able to kind of put in his knowledge and maybe help the Shubharthi and the Shubhankars deal with the world around them, the community around them, the workplace, the school, and with peer groups and colleagues, and with themselves. So the trust is what is going to kind of, get everything going. So until that happens, nothing moves. Can I have the next slide, please? Which brings us to the most important thing. So the rules are very simple, isn't it? Honesty. When I say honesty, I'm not trying to be judgmental that people lie. It's just that people do not want to say exactly what they're going through. And only when they do that, the family is going to be able to understand, and the family needs to be honestly telling the person, the Shubharthi, whether they understand, what little they understand, how much they understand, how they make sense of this. And together, when they take it to the doctor also has to listen and understand. When it comes with honesty, the information is really very good and very useful for the doctor to think. And the doctor needs to be honest too. The doctor needs to be as open as possible. I'm not saying that the doctors are dishonest or they hide everything from the patient. Sometimes information is difficult to kind of give, because sometimes this information Sometimes when when the doctor makes a diagnosis, the patient or the family immediately say, "Are you labeling me?" But there's no labeling involved here. Is only for a name for the problem, a way for the doctor to understand, and perhaps start formulating more helpful treatment processes. So that's where the labeling comes in. The labeling does not mean somebody is judged to be X, Y, or Z, some kind of a, you know, madman or whatever you call it. There's none of these things involved. The label is just for the doctor to understand the whole thing better and perhaps communicate with other professionals who get involved. So the honesty from the doctor sometimes is, um, it sounds rude, maybe, sometimes sounds judgmental. Nobody wants to be rude or judgmental. Okay. The doctor can sugarcoat the statement in some way, but then the sugarcoating should not be a lie. The sugarcoating is just to kind of, get the initial message across. And once there is a mutual trust and we can patiently wait and communicate honestly, we understand the whole problem much better. Because, see, mental health issues is not a blood test, it shows viral positive. There are antibiotics which definitely help. Go ahead, start the antibiotics, be on a good diet plan, rest, plenty of fluids, and bingo, you're right, isn't it? Mental health issues are not so very, you know, straightforward. I'm not saying typhoid is a simple problem to treat, but compared to what we see, this is a huge problem. Typhoid is so simple to treat as compared to, say, somebody who's going through a mental health issue. Tests we do are only to kind of rule out any other primary issue which might contribute to the mental illness. But mental illness per se, there are no, you know, full diagnostic lab tests or MRIs or scans or EEGs. You know, there used to be a time, not nowadays. Thank God for that. There used to be a time when I've seen patients come into me and said, "Doctor, I did an EEG," and the doctor who saw now that is a very sad situation. If Because sometimes what happens, the doctor is unable to make the person understand and accept that there's a problem, and the doctor uses this ploy. I don't think doctors, at least most doctors, I don't think they use such ploys nowadays. People are, we need to kind of sit down, talk, understand, and when that, process happens patiently, there is definitely a greater sense which comes out of the whole picture. And so the game becomes a much more easier to play and move towards, a potential victory, I would say. Yep. Shall I stop here? I've been waffling away. See?
Doctor, we're at the end of your presentation.
Yeah.
Well, before we open the floor, that I think most of you would have got what a Shubharti means, meaning a person who is a seeker of well-being, who looking at well-being, of good well-being. On the other hand, what is normally which we call Shubhankar is the caregiver or care person. And communication is required not just from the Shubharti alone, but the Shubhankar as well. This is something which I would like to just add to what you were saying. Any
True.
questions you can address in the chat box, and we'll present them to Dr. for his views. Just to kick this off, I have a question, doctor.
Yeah.
How can one handle denial?
What are we denying and to whom are we denying? Because the issue we are facing is not about me having or not having a disorder. The issue is about me feeling uncomfortable. I don't feel good in my skin. I'm not feeling happy in my day. I'm not able to sleep peacefully. I'm not able to do whatever I want in peace. So I am not in a state of comfort. There is some discomfort. If I understand that I am in a state of discomfort, then I need to talk to people who are with me, who love me, who care for me, who want me. They want to know that I'm in discomfort. If I don't tell them, how are they going to know that I'm in discomfort? Isn't it? So once this person talks about this, again, it's quite easy for the family member to say, nothing wrong with you, nothing wrong with you, you're just imagining things. So there is denial happening over there. The family member also needs to kind of be relaxed, be a bit patient, and accept that this person is talking to them about some unique experience he is having. It's not like, that he is putting on an act to kind of escape some important, responsibility, isn't it? So that's what needs to be there. The community denies things too. For a long time, it's been thought that the community only wants to kind of, deny that there's a problem here and throw this guy into an asylum, lock him up, and he's away from the community, isn't it? So that's the community also doesn't want to face. The community needs to understand this can happen to any one of us, and it is not because of the community or the family or anybody around, or for that matter, because of the individual is suffering, that this problem is happening. So this problem is happening despite everybody's good intentioned approach towards life. Yeah.
We have another question. Sorry. Manjini, could you take over reading the questions?
Yes. Thank you, Ganeshji. Our one question is, how can the doctor determine whether the Shubharti is honest or not? Maybe his illness is preventing him from doing that.
Quite true. Maybe the illness is preventing a person from being open and, completely honest with whatever he's experiencing. So that's where the patience comes in from the doctor and from the family and from the Shubharti too. Um, wait until the trust develops. As a doctor, what I try and tell my patient is, look, I'm not here to hurt you in any way. I'm not here to label you or stigmatize you or put you into any kind of, problematic thing in life. I'm here trying to understand what you're saying, trying to make sense of it, and I'm trying to feed back to you whatever sense I've made, and work with you to find a way forward to get this, in a better way, better situation. So once I am able to kind of do this, so this sometimes doesn't happen in day one, but and I can get a very hostile person who kind of who's been dragged in, a friend or a family member who himself is angry or upset or frightened or worried. If the doctor loses patience, that makes the game a total chaos, isn't it? So what I need to do as a doctor is to wait. There have been times where I've understood a case. I mean, maybe people would not even able to be conceptualize that. I've actually understood a patient is actually going through a schizophrenic illness 3 years after I've seen him first. It's taken me multiple sessions of talking about what's going on, what is happening, various things, various distractions, and finally, this I can still say 3 years after I started seeing this person. I was seeing this person at least once or twice in a month. After so many sessions is when I was finally able to get through and understand. Until then, we were only kind of doing cosmetic things, helping with sleep, helping with appetite, handling other health issues. So it took a long time. So this trust, until it develops, have the patient and I have a rapport with each other. I don't know because I'm not an investigator. I start with an idea that I trust you. I don't see any reason for anybody to lie to me. Of course, I understand there would be various thought processes in their own mind, which might prevent them from, stating the entire truth to the doctor, which is where the patience and the rapport building exercise. It takes time, isn't it? I mean, I'm not saying it's going to take 3 years with every patient. I'm telling you the worst case I've gone through. It took 3 years for us to understand each other. And then it moved pretty well after that.
Uh, Thank you, doctor, for clarifying us. The second question which we have is from Anjali Shukla. What are the early signs of mental illness?
Well, the early sign is a person feels perplexed, a person feels confused, person feels ill at ease, and is not able to explain why that is happening. It's usually the thing which follow, when you're ill at ease, the first thing which gets affected is you can't sleep very easily. Your concentration at whatever you're doing seems to suffer. A bit less than what it can be usually. Your basic biological functions can get disturbed. Your appetite can go down. In some people, even bowel functions get disturbed. Sexual functions, libido decreases. So these are some things which we commonly see very early on. And one other thing is the family member usually notices this even before the patient himself can, open up and say, because they are seeing a change in the way this person is interacting with them. Okay.
Doctor, when we answer this question, there might be confusion because there are people who they suspect too much about themselves. If I am losing my appetite or if I am not sleeping for some time, they may get anxious that is it a sign of mental illness. So when we are supposed to say that because there are people who have this anxiety that something is going on
Yeah,
with me, so how
true.
to differentiate that, because we get these kind of questions a lot, so I just want to
True.
clarify.
When you're asking me for certain early warning, early signs,
Right.
these are the usual early signs. And there are people who have this anxiety, like any headache is a brain tumor, is how some people interpret or worried about. They sometimes tends to catastrophize every situation to be the worst. Even there, you know, one has his own reasoning power, sits down and thinks, and sometimes you're able to kind of figure out at least a bit more and say, look, okay, I've not been able to sleep because I'm worried about what would happen to my, close relative who's admitted in hospital with typhoid. I'm worried, so I can't sleep. Or I can't sleep because there's a deadline at work. We figure out some things. But then when people are not able to figure out, I think that's where they need to talk. They need to talk to people who are with them, the close friends, family, people they can trust, and together They can perhaps, if they're not able to get any kind of joy in reducing these, unpleasant experiences, then this needs to go to a doctor. Yeah.
Yes, thank you, doctor. Priyanka, you have this question. Is it okay if we take it last because there are other questions? So I'll just ask your question last, okay? The other question, doctor, is how to tell this that your experiences are not real.
Well, the experiences are very, very real to the Shubharti. So don't ever make this thing of saying that the experience is not real. They are not based in reality. That is, the real world does not, this is not there. But inside the person's mind, the whole thing is happening. So to kind of blanket tell people this is not real makes them start thinking that they're imagining something, or they're being told that they're imagining. So if I start hearing a voice which tells me how I look and what I've worn today and how I'm talking, I'm hearing a voice. You are not hearing that voice. I am hearing the voice. And if you tell me, hey, you're just imagining the voice, then I'm going to get angry with you because I can hear the voice as loud and clear as I can hear your voice. So to me, it's very, very real. To say it's not real puts me in a position where I say, okay, if I say anything more, this person is going to think I'm crazy, or this person is not going to be helpful to me. So I'm going to shut up and I'm not going to tell him what I'm going through. So I'll nod my head and say, okay, you say I'm imagining, okay, fine, thank you. And I'll go away, right? So you're not
The,
going to tell this person this is not real. You're going to accept this person, say, you are having an experience which nobody else is sharing with you. When you believe you're hearing a voice which is talking to you, you're really hearing. But your spouse, your friend, or your family, or your doctor who's sitting next to you is not actually hearing that voice. You're the only one who's hearing that voice. And that is one huge hurdle we got to kind of, cross. Yeah.
okay. Does that answer your question, Anand Ghurpade ji? Okay. The next question is, in the
Yes,
case
madam.
of, okay, thank you. Uh, uh, in the case of a person with mental illness, there will be many social things that pressurize them and cause problem, and there is a mental illness. How does the
Could you
doctor
repeat
find
that? We had a bit of a glitch there. Could you repeat that question?
uh, in the case of a person with mental illness? Uh,
So
I
let me
don't.
let me say I'm able to see the question.
Okay,
So
sir.
there is
That
this.
will be better. Yes, sir.
Yeah. See, there are social things that pressurize patients and cause problems, and then there is mental illness. See, any kind of mental health issue is not an illness in the mm, plain medical sense of it. It's a biopsychosocial issue. So biological is to do with the process, something which is happening inside the brain. Psychological is to do with the way each person's psyche is. Like you can have a thin person can have diabetes, a stout person can have diabetes, an athletic person can have diabetes, a couch potato can have diabetes, isn't it? Diabetes is the same disorder, but it affects these four people in different ways. So same way, each one of us have got our own mental makeup, our own psychological, you know, givens. So that has an impact on on the mental illness, on the biological aspect, and of course the social situation, where the environment, the way where we work, the kind of friends we have, the kind of pressures we face, including political pressures and famine and economic pressures and stuff like that. So biopsychosocial is the key word there. So the doctor has to kind of listen a lot to the patient to get as many things in his within his purview, within his case sheet, and put them together and understand which of these problems needs medical treatment, which of these need, environmental manipulation. Like Ganesh was talking about the earlier thing, where I need to remove the portrait with a horse. I need to do nothing. I need him to do anything else there for that person. Apart from other things you're facing. But this was a problem which got sorted out. This is not part of his illness at all. Yep.
Uh, any more questions? Thank you.
Yeah, like Wordle. Ganesh. Yes. Every step adds more to the information. Yeah. I only hope that this happens within those given time, no? In the 5 tries, and not 13 3-year try like I had to go with that person.
Uh, Sir, we have other question
Yeah.
from Shubhashri Desikan. Are there essential difference in manifestation in men and women?
Not really. The disorder is the same in men and women because of various social situations which men and women face in this society. There could be different impacts. Otherwise, the severity of the disorder, the whole the treatment process, everything is almost the same. Of course, there is this woman's biology which matters, where some things like pregnancy, I need to really really think hard. So there are some medicines which might work, you know, pretty okay with a man, but could be very very disturbing for the woman's menstrual, regularity. So I need to kind of look at that. So that difference only. Otherwise, there is no difference in manifestation between men and women.
Okay. Uh, one.
I've got the next question there, which says, after acceptance, should one disclose one's mental illness to everybody, or there need to be selective? Now, there is no need to disclose your mental health problem to anybody at all. There is no need to disclose your diabetes to anybody at all, isn't it? So there is no necessity to disclose this. But then you have people who are very close to you, who are supportive. It is helpful when you open up and talk, because the person who is close to you would also be wondering what is wrong with you. Because this person is, in a way, as perplexed as you are with whatever is happening here. So if you actually can disclose, you know, to the person around you, then it might help. The disclosure becomes a big problem, especially at workplace, when one expects, some compassion, some time off to kind of tackle something. If you look at the recent fiasco which is going on in Australian cricket, I guess you have seen about Mitchell Johnson, somebody I think, talking about why, what's his name, the opener, why should he be given a farewell match? And the selector is questioning Mitchell Johnson's mental health. Now, the same Cricket Australia has been so good to various other people who had mental health problem, given them time out, asked them to go back, get this sorted out, get this treated, and once they're good, they've brought them back into the team. And the same Australian selection panel, which now is being so very nasty to somebody just because he dared question their process. Am I making sense here? So there is this disclosure is not very easy with everybody. All I would say is there's nothing wrong in telling people that you're going through a mental health issue, provided it is said with an intention saying, please bear with me, I'm going through a mental health issue, I need time to sort it out, would you just, give me that time? You don't have to kind of say, if the person asks you, wait, what's happening to you? Tell me, explain to me, I will counsel you, I will help you. You don't need to do all that. You need to talk to somebody who really knows what's happening and somebody whom you can trust.
Yes, doctor. Next question is, can childhood trauma cause mental illness?
Yes, like I said, biopsychosocial, isn't it? Any kind of huge trauma can have a lasting impact in our developmental process, and that can actually lead to some problem here. If there are any number of children who've been through extremely distressing situations, and that has impacted, their whole development, their educational process, their ability to make friends, their interactions with people, their growth in their own community. This can happen. Yeah.
Uh,
There are key, the brain basically is not a completely, you know completely made machine. When it rolls out, as a car rolls out of the of the out of the factory, the car is, for all practical purposes, a complete machine, which is just, it needs some reasonably knowledgeable person to sit down and drive. While the brain is not that. The brain development continues to happen even much later after people are born, and there are very key areas, key times, in growth, where, certain experience, like for instance, as a little child, you learn to trust your world based upon the interaction you have with your, uh, you have with your family, with your mother, with your father. And if there isn't a trusting relationship there, the child does not actually, develop this ability to trust at all. So when there is no trust formed even at that very tender age, this is going to be, a person who is pretty paranoid about everything that he sees, right? So the whole personality develops more skewed and not very, balanced. Yeah.
yes. Mm, the next question, sir. How does we explain when a person who is having mental health issues, he always think about the death of family members?
Um, no, no. Somebody whose family member has passed away and this person is going through a bereavement, yes, he would definitely be thinking of that. Is that what you're asking? Or there are people who are constantly worried something might happen to their family member. My son has gone, to school. Is he going to, he's taken a cycle and gone out? Is he going to have an accident? Right? Which one?
Uh, uh, Dr. Anand Ghorpade, would you like to clarify on that?
Sorry, just you explain that is the same example.
The second bit, right?
Same
Yeah,
example.
exactly,
When
isn't it?
the
Hmm.
yes,
So my son has gone out on a cycle,
Hmm.
and I'm frightened to death my son will have an accident, right?
yes sir, yes, same.
Okay. At one level, it's normal concern, isn't it? I want my son to be safe. I want my son to have a good time. I want my son to go to school, study well, you know, and learn to drive a cycle well, enjoy cycling as much as I enjoyed cycling when I was young. But I'm also worried for him. And so I have this idea, that something bad could happen to him. Then I need to kind of sit down, relax, teach my son to cycle properly, go with him, in traffic, and generally help him cope with traffic, and make him understand how to drive a cycle. When I do that, I am gaining confidence, isn't it? But there are situations where people have this persistent anxiety that anybody who's out of their sight is not going to come back. Anything could happen. Well, in reality, anything could happen. But when people go through this in a big way, they're basically going through an anxiety disorder. and that anxiety disorder needs help with therapy, with medications, with relaxation, and trying to kind of understand how to kind of face the scenario in a more confident way. So, person who's having this repetitive anxiety of something bad is going to happen to my family is definitely going through a mental health issue and needs help and treatment. Yep.
Yes, sir. Yes. Thank you. Thank you, sir.
Thank you. Sir, the next question is big one, so could you just, uh,
The
ins-
Priyanka Bardes, correct?
yes, sir.
Okay, I'm just reading out MSc B.Ed. Since I was a student of science, having auditory hallucination, which my family members couldn't hear, I was sure it's superstition and I can make a difference between voice of real world and imaginary world. So inside from day one, I have trouble of hallucinations as and when noise pollution is going on. What can I do for that? Okay. See this voices, hallucinations. Okay. Uh, we sometimes hear a voice in our mind as opposed to voice in your ears. Now you're hearing me right now. This is a voice in your ear. But when I start thinking of a song which I like, the song plays in my mind. Now that is not a hallucination, isn't it? Because I'm not hearing that like I'm hearing this click. This is hearing. So if you understand one, am I hearing something or in my ears or am I hearing it in my mind? So this is step one there. Two, one is intelligent. One understands a basic, mechanism in life. One understands various things, and perhaps a science student does know that there is something called hallucination. Yes, and the science student understands, look, I am sitting at home. I just cannot hear a teacher talking here. So this basically is an unnatural experience, and therefore I don't have to believe it. I don't have to react to it. I don't have to think that's real. Just because I just heard my teacher say, tomorrow you don't have to come to school. Now, I'm not going to take leave because there's no teacher here. I know that. So I will go to school, isn't it? So that is the distinction we make. Real world, imaginary world. And I start imagining things. I fantasize. I can fantasize having a chat with Mahendra Singh Dhoni or Virat Kohli. And I can just close my eyes and go on fantasizing, to my heart's content. But I know it is imaginary. I know I'm doing it. But when I'm having hallucinations, I have no control over it. I cannot make it stop. I cannot make it start. It is there. It is there all the time. Various situations around me, when I'm a bit more distracted or when I'm focusing on something very interesting, these experiences might tone down a bit, but they still are there. So they are not in my control. Yeah?
Yes.
The insight, when you talk about insight into this, yes, when you can distinguish that this is a hallucination or this is my own imagination. There are three different things, isn't it? There's a real voice, there's a hallucinatory voice, and there is an imaginary voice. There are three different things. So if I can distinguish between these three, an imaginary voice needs me to examine my own ideas, my own feelings, and I can cope with this. A real voice needs to be answered, be you have a discussion with that real person who's talking and find an answer. The hallucinatory voice, once you're able to distinguish, number one, it should not be obeyed. Number two, it should be discussed with a professional, and it is actually an abnormal brain process. If I'm having hallucinations, it's an abnormal brain process, and I need some medication to reset the biochemical balance. Yeah.
Yes.
Have I,
Doc-
Priyanka, is it okay? Have I answered?
Yes, sir. Yes, sir. And I come to know that real, imaginary, and hallucinatory
Yeah.
three areas I can manage as a
Yeah.
better by this your example.
Exactly. You distinguish and you tackle each one of them in a different way, isn't it?
Yes, sir. Thank you.
Okay.
Okay. Sir, how do you deal with it when someone tells you about their illness?
Thank God they tell me, isn't it?
Hmm.
My worst nightmare if a person sits in front of me and doesn't say anything.
Right.
When they're going through some very great difficulties and they don't tell me, I don't know. You know, it's like, I mean, I'm not putting anybody down. See, I have a dog and I'm absolutely in love with my dog. I love my dog. Okay. But when the dog looks at me, I don't know whether my dog really wants to do something. Whether he wants to be let out, to relieve himself, whether he wants to have a drink of water, or whether he wants to cuddle. I don't know. You know, hmm? Because I honestly wish I could understand my dog, much better. Yeah.
Yeah.
So when somebody doesn't tell me, I am perplexed. I'm trying my best to guess and guess and guess. And no amount of guesswork is going to be useful in a clinical situation. With a dog, yes, I can guess. I can keep guessing based upon various factors, just like a mom guesses with a baby. This thing about a mom can understand the cry of the baby and know what the kid wants is, I would say, is a very romantic notion. The mom uses her brains, her intelligence, her knowledge of the scenario, her knowledge of the kid's usual needs, and responds to the cry. Yeah.
Doctor, I want to ask you from all our Shubhartis because we have this support group meetings every week.
Hmm.
So, as a doctor, which kind of precise information you would appreciate if Shubharti gives you? Because there are multiple patients in line, and we understand that doctors are their schedule is hectic and we have limited time. So, what kind of information, basically what kind of log we should be keeping? Just a guideline.
I told you that there are those three rules, no? Patience, trust, and honesty. So all the
Okay.
information, has to be given. If somebody doesn't understand, talk about it again.
Hmm.
Trust and be honest with this person. Whatever you're really experiencing, tell the doctor. That's what I would like, and I can discuss with my patient at the time and figure out which is the key one to handle, which experience, which needs medicines, which needs working with a family member to kind of pipe down, and which needs you know helping the person learn to cope with his own experience, right? So as they need to tell me
Yeah, okay.
what they're really going through.
Okay. Thank you, doctor. The next question is does alcohol play a role in enhancing already persisting mental illness?
Yeah, alcohol per se, um, an occasional drink should not really create any mental illness, but for a person who is drinking heavily, enormous amounts of alcohol, issues secondary to that. See, there are other drugs like say hallucinogens, perhaps even with some people, cannabis. Some people, cocaine, all those things. They can all create a greater problem. Alcohol doesn't do immediately, but a regular drinker who drinks excessively, who is not able to stay away from the booze, depending on irrespective of what's happening, then there's going to be, a lot of problem. The problem worsens.
Okay.
Ganesh has had a question there. Concern should not instill fear. Yeah, I, I am concerned about my relative who's going through something because I'm afraid for him. So I'm starting with fear. Fear is whole part of this whole situation. And if I am the Shuvarthi, I am afraid to tell somebody. And if this person says, "Oh my God, Rangarajan, you're going through this. Okay, it is a bit worrying. But then it becomes a problem only when nothing is done and people go round and round in circles. I cry on my, you know, on my spouse's shoulder, my spouse cries on my shoulder, we both hug each other and cry and say, oh my God, what can we do? This is the end of life for us. That's where the problem comes, right? It's when we decide, I've disclosed it to a person whom I trust, and this person is also upset. We go through an emotional situation, and then we relax, the emotions tone down, and then thought process begins, some logical thinking happens, and we decide, okay, fine, this is the way we are going to work this out. This is the person whom we're going to reach out for help. You know, yeah.
Yes.
Come.
Yes. Mm. Doctor, our next question is, uh, the person is asking, please let me know the improvement in job role or career for patient of negative symptoms of schizophrenia.
Well, people with chronic schizophrenia, with negative symptoms and cognitive symptoms, it is more difficult for them to do things which they've been doing earlier. Yes, there is a problem there. Sometimes, you know, uh, it's easy to say, take an easy job, take a part-time job. Maybe, yes, some of these things help in reducing the pressure. But negative symptoms and cognitive symptoms which interfere with work performance, they need some medication, they need more, treatment, cognitive therapy for, cognitive retraining to help people to improve with their cognitive process, and that helps. There are people who've had schizophrenia who have done pretty well and gotten back to their pre illness level of functioning, while others have not been so very lucky and they've missed out to some extent. So things do differ, it differ in people in the way they recover, to the extent they recover. But then we shouldn't stop working. There are measures to keep trying. There are newer medicines which are supposed to have a better effect on the negative symptoms, better effect on the cognitive symptoms. There's cognitive therapy, it's cognitive retraining, which is part of a very well established rehabilitation process. Sometimes people who are recovering from schizophrenia need to work in a sheltered employment where there is some supervision and there is, the not these usual corporate deadlines and pressures. All these things help, and you know you need to kind of keep working at the best level of efficiency and move upwards from there. Yeah.
Yes.
Do we
Uh,
have time?
uh,
Doctor, can we just take another 5-10 minutes of your time?
Yes.
Okay.
There was a long question in Hindi. I can't read Hindi.
okay. Sir, what if both husband and wife are suffering from mental illness? What should be done in this case of scenario?
Okay. Well, the husband should care for the wife should care for the husband. They both should perhaps see the same psychiatrist who can work with both of them together. Understand that there is this very special situation.
Okay.
I mean, I've had patients where both husband and wife have been through very serious illnesses,
Hmm.
and you know they are able to see similarities as well as differences, in what they're going through, and maybe, uh, I mean, the peculiar thing is the husband would be hallucinating away in one particular manner. The wife would be hallucinating differently. The husband would tell, doctor, whatever my wife says is not real. It's a hallucination. Nothing like that is happening, very clearly.
Hmm.
And he will bring his wife for treatment. And the wife will do the same thing,
Hmm.
you know, because for them, See, we hear of shared psychosis. This is not that, okay? This is independent illnesses, two people having. And they're whatever they hear, whatever paranoia, whatever hallucination, whatever other symptoms they have, they are different. They're very, very individual. And they're able to talk about it. It makes life more difficult, and hopefully there is a responsible carer who can, guide them. I've had some situations where uh, two of my patients have met at the clinic, and have liked each other and gotten married to each other. And that's gone on quite okay too. I'm not saying I run a matchmaking bureau. It just so happened that these two people met in the clinic and then they happened to meet outside and they really liked each other. Yeah.
Okay. The next question is how to communicate best with the person having paranoid personality disorder. Uh, Vidu, will you please, mute your mic?
Hello.
Yeah. Paranoid personality disorder is a very, very, very difficult thing and very difficult for anybody to live with such personalities. When somebody has a personality disorder, then what happens is this is not an illness. This colors every little bit of behavior which this person does. Right. So uh, it's like walking on eggshells every day. Um, you need to go in with the husband. You need to go there to the doctor, to the therapist. It's a very, very long term process, and it's very, very difficult. Sometimes medicines help, sometimes psychotherapy helps, sometimes being firm helps. The one thing with when you're living with a paranoid personality disordered person, if you use a convenient lie so that it's easy to get away, then that's going to create more trouble. So what I always tell my the people I see is be honest. You you know you're I mean the husband might keep on doubting that the wife is having an affair with somebody. If the wife, even for out of anger, says, "Yes, I will have an affair when I please. That's my business, none of your business." Now, that will actually worsen the whole scenario. It is true, you know. If the wife wants to have an affair, it's her business, really, and she doesn't have to kind of take the husband's permission. But expressing it in this manner, when you're not having an affair, will make this person become even more paranoid. Yeah.
The next question is should the information be given orally or written in advance? Vartak sir, what do you mean by which information? Uh,
I think sir is
Go.
referring to the outcomes and symptoms and things
okay.
like between two appointments with the doctor. Am
Okay.
I right, Anilji?
Yeah.
Many times the doctors have a limited time. So should the information be given when we visit him in his clinic, or should the information written in advance? Because events occur and during the visits. So sometimes we forget
Yeah.
information also. There is likelihood.
Okay.
So yeah.
I tell my patients to come in with a shopping list. Okay.
Hmm.
You can write down whatever you want to ask. You can make a note of it. Come in with a list of things which you can really, put across to the doctor. Yes, everybody has time limits, but I think if you have real issues, your doctor would not mind giving you this kind of time to discuss. Yeah. If you're repetitive, if you're asking the same questions over and over again, the doctor would say, "Look, we've discussed this. There's no need to go over this again, right?"
Okay. Yes.
There are, I would say, there is a scenario in especially in India, where if you're working in the government sector, I've had my colleagues who have to see 300 patients in a session. There are four doctors sitting there, and they have to see 300 follow-up cases. Now, that is a problem. Yes, nobody seems to have time. Yes, and yes, making a list, knowing what are the things you want to ask, actually makes it better. But then again, there are times when you really want to have a chat with somebody, really express whatever you're going through. I mean, that is a big problem within this government sector hospitals where the workload is so much that the professional does not have time to deal with it. But I guess most doctors in private sector would give you the time, and if it's not happening, at least they will put you onto a psychotherapist who would be basically there to give you the time, sit and talk. Yeah.
Thank you very much.
Thank you.
Okay.
Doctor, last question we are taking. What treatment approach is best for PPD?
Pardon?
Uh, which treatment option is best for paranoid personality disorder?
Ah, see, there is no one size fits all kind of answer for anything to do with mental health. Okay. I mean, see, like clozapine could be the medicine which is there for the worst case of schizophrenia, but that doesn't mean everybody has to be given clozapine, isn't it? So clozapine might work in all cases. That's what we believe. It doesn't work in all cases too. So there is no one single treatment. The main thing is, yes, there is a combination of certain medication, regular therapy, a lot of family counseling, and a lot of work with a family member to help them, cope with this, and learn to handle the person with the paranoid personality. Hmm? Yeah.
Thank you so much, Doctor. That was quite enlightening. And I understand that the person could come from a different mindset. Manifestations can be very different, but some of the learnings we take away are very common. I mean, like, for example, I'm sure you would agree that many of it is caused by our own hopes and fears, and
Hmm.
not just something out there, but
Yes.
the interaction of our hopes and fears with the environment. Really appreciate your time. Do we, uh, before we close, uh, I would request Manjini to uh, post our contact details, and if anybody would like to get back in touch, is that something which is okay?
Uh, I hope everybody can see that.
So the last two tiers of the three mental health pyramid is about informal care, and partly this informal care is with self-help groups, and it is a low-cost, high-impact kind of intervention. And our self-help groups work with the recovery intervention method, and it has been adapted for India, and we meet